Steve, that was terrific, and totally sets up kind of the conversations that we'll have later today and through the work of our whole roundtable. We only have a few minutes. Oh, and let me just say both, I mean, at least as one co-chair, I'm looking at George, he's back there someplace. I mean, I think I accept your bold proposal, as something to try to, at least the spirit of sort of get done. And let me say also, that little metric tool that you had in terms of how do we develop a culture, those are some of the elements that need to get to. So I think those are going to be really important. We will, however, take 5 or 8 minutes for questions. We really don't, I mean, this was so provocative, we could spend an hour with you, but we're not going to be able to do that. But let me take a couple, including one of your friends for Berkeley who has gone to the microphone.
Hi, Steve. Mary Pittman, Public Health Institute.
Can you hear?
Mary, you really get around.
Wait, Steve, you can't say that in public. We were at an event together Tuesday night, okay, that's...
Yeah.
And we had the opportunity to work together on the Community Care Network demonstration over 7 or 8 years, and one of the key factors was leadership. I want to make a little bit of a plug that the CDC in its wisdom has invested in a multi-sectoral leadership academy to try to make the bridge between all of these different sectors that need to learn how to learn together, how to work together. And it's not just intuitive that people are going to come and speak different languages from the different perspectives they come from. But I think this Leadership Academy is really providing some great opportunities. It's just in its second year, but the kind of focus and actions that the communities have taken on in the first year have really advanced their work tremendously. I wonder if you could talk, because you did a lot of evaluation work about that, and just, why is that leadership component across sectors so important?
No, it's great, Mary, and thanks for mentioning the Leadership Academy. And that needs to filter down into the states and local communities, forums to develop that kind of leadership, in addition to academic preparation we try to do at universities. So what we've observed through the Community Care Network, but just other experiences as well, inertia is, the inertia and the fact that individuals that come together, they have to run their own organization and the goals of that organization and give a lot of time and energy to that, and that often comes into conflict with the time and energy and so forth that needs to be put into the cross-sector kind of work. So that is part of the challenge in order to get that. And that can be done, though, by the individual leaders. And one of the keys is where the individual organization begins to incent their leaders in terms of time and incentives to engage in community-wide health improvement work. 50% of your job is to work with the community coalition to achieve the goals. Your job is to get the right people to work on an information system that's going to articulate with the other folks' information system, right? And so that is the job. Your job no longer is just to run this individual organization. Our goal now is to be a part of this larger coalition, because CMS or somebody else, the private sector, that's where the resources are going. And we're not only going to be successful if we can capture some of those resources, and that means we have to be much more interdependent. So the leaders are the ones that can go to their boards and say the world is changing and we need to help lead this. So the leadership component is just critical. The second thing I will say is the depth of leadership that's needed. It's not just the person at the top or one or two people. Sometimes that can work, you can pull it off. We have to deep down the second, third, and fourth layers, we need leaders as well. So the key is leading from where you are. Leading from where you are. That's the receptionist. That's, whomever it is needs to understand what their job is and how it relates to the overall goals of the organization. So we need really a depth of leadership in these organizations, not just one or two people.
Okay, we have time for one more. Did you have a comment or a question? One more, Steve.
Okay.
I'm David Stevens from the National Association of Community Health Centers. And my question is related to just what you were talking about. It seems that the bold proposal, it depends on political decisions. And in fact, I was really heartened by the last slide about in terms of what people are feeling around health. And I was wondering if you had some comments about how the political will, in addition to what you said at the local level about the leadership, can support this kind of change in our country, especially where people feel that citizenship is basically an obsolete kind of idea and are not engaged in this process.
Yeah, David, it's a huge issue, and we all know the gridlock in Washington there, which is very dispiriting to so many people. And it was a breath of fresh air. Mary alluded to an event she held at her home the other night for Don Berwick, who, Don, as you know, is running for governor of Massachusetts. He was out in California, I think, trying to dig some gold out of the state for his campaign. But it was really heartening to hear Don talk, because he's the breath of fresh air around citizenship and what we can all do. But in terms of political will, there's more of that in some of the states. As you know, we can't look for it now necessarily from the federal government. Of course, our president is still hanging in there, and that's great. But the political will is going to have to come, I think, locally and from the state level. Now, California is an example. Governor Brown basically does not want to touch health. He's had a lot of other problems with budget and that. And the idea behind Get Healthy California really came from the SEIU and Dave Reagan and the labor union, who said, this is important to us, it's important to our members. And so the governor basically said, well, you know, assigned it to Secretary Dooley, our Secretary of Health and Human Services, and she ran with the ball. And then we had initiated a private sector effort called the Berkeley Forum, which is made up of all the insurance executives in the state, the CEOs of all the integrated health systems, the big medical groups, and the public sector. For about a year, a bunch of meetings, and they've come out, it's released, it's on our website. Go to global budgets as fast as you can, get rid of the fee-for-service, get people walking, get people in these integrated care systems, et cetera, et cetera. And I think that's why you see these averages so high in California about, hey, let's maybe try this out. So the point is, we don't have a governor here in other states do. Oregon's got Kitzhaber, right? So you can't necessarily wait until you have the right people in office who's going to make this a personal part of their agenda to get reelected, right? You got to do it, I think, with the private sector and sometimes ground up as well. But it's great when you do have the political leadership in office that can get behind that also. And the final thing I will say is, whether we're talking about jobs and our education and everything about our economy and so forth is so massively influenced now by how much money we're spending in the health sector, that can be leveraged as well. And we've got to do much more of that to say, unless you do something about this health sector stuff, the other things you're really concerned about aren't going to happen. And so we need to get that message out there as well.
So Steve, thanks so much. Let's give him a round of applause for those thoughtful comments. And you're not off the hook. We intend to return to you for some ongoing advice as we go through our work. But thanks so much for your time this morning, Steve.
Absolutely. I look forward, David, to continue to work with the group. It's terrific that this is occurring. Thank you.
Okay. So this was this a great morning or what? Do we have ideas, you know, to get going? But we still have an afternoon of additional ones, if you think you can stand that. But right now we get to break. We get to break for lunch. Roundtable members and speakers can go back to room 125, the lecture room, where lunch will be served. For others, there's a cafeteria in the basement, and we will reconvene right at 1:20. We'll take 10 minutes out of our lunch slot to accommodate our morning session. So we'll see you back here at 1:20 for the afternoon continued session. Thank you very much.